Welcome to Hello Doctor Talks. Today we are going to discuss about adenoids. To discuss more on this, today with us Dr. Gayatri Moge. Dr. Gayatri Moge is a pediatric dentist with subspecialty training in child psychology, cleft lip and palate. She treats children with birth defects of the head and neck and pediatric ENT problems. She is also a member of the American Cleft Palate Craniofacial Association, Indian Society of Pedodontics and Preventive Dentistry, National Academy of Medical Sciences. Doctor, what are adenoids?
So adenoids are basically, these are lymphoid tissues which give immunity to the body. So these in children, they are the ones which start the first immune development process. They enlarge for a couple of years, and as the child grows, they reduce in size.
Doctor, what causes adenoid infections in children?
So in children, usually there are many causes why these adenoids can get infected. Now the primary one among them can be allergies to start with change of weather. There can be dust, there can be pollen allergies, there can be food allergies. Or there might be any bacterial infections which cause the adenoid and tonsillar tissues to enlarge quite a lot.
Doctor, what are the common symptoms of infected adenoids?
Now with infected adenoids, the first thing that happens is it enlarges in size. So now since these tissues are at the back of the nose, once the air tries to enter through the nostrils inside, these obstruct the proper flow of air. So therefore breathing becomes very noisy. Now since this causes children to become very uncomfortable, they start keeping their mouth open while sleeping, and otherwise it becomes an habit. So this also causes snoring in children as young as 2 and 3 years and can progress into a more serious disorder as they grow older.
Doctor, how are infected adenoids are diagnosed? Is there any specific test for this?
Now an infected adenoid is usually diagnosed by an ENT surgeon or a pediatrician to start with if that is a younger child. Now we can have x-rays which show the side view of the face and neck, which shows an enlarged mass of the adenoids. So this can give us some amount of diagnostic information, but otherwise we need to pass in a thin tube called as a flexible nasoendoscope to check the size, color and if the adenoids are infected.
Doctor, when is medical treatment recommended? When can be surgery considered?
So for adenoids, once the doctor is able to figure out that these may be infected, we need to first find out what might be the cause of why these adenoids are enlarged and infected. So if there are symptoms of allergies with the necessary tests done, such as the elevated immunoglobulin E levels, then the medication is required for anti-allergy treatment as well as some amount of steroids which are given in the form of nasal sprays or the tablets or any other form of liquid medication. If there is a bacterial infection, then appropriate antibiotics are recommended. So this medical treatment is usually done by pediatricians and by ENT surgeons. So once a child needs more than 3 courses of antibiotics in 6 months, that means these medicines are now not solving the problem, and therefore ENT surgeon might recommend surgery for these children.
Doctor, are there any preventive measures that parents can take?
Now in terms of preventive measures, sometimes it becomes difficult, but then reducing exposure to allergens, reducing risk of bacterial infections and getting appropriate treatment might be the only preventive measures that will not allow the infection to worsen. Now, if an infection is not treated properly or just given over-the-counter medication without consultation by a medical specialist, then that would mean that this entire infection is not treated properly. Therefore, it keeps occurring repeatedly and also spreads to the adjacent structures. So, number one, to prevent any such infections and recurrences in the future, it's essential that a medical specialist be consulted for all these problems, and that parents should not give any over-the-counter medication.
Doctor, how can parents manage their child's discomfort and pain?
Now the child is in a lot of discomfort because they are not able to breathe properly and also get up multiple times at night because the nose feels blocked. So they end up mouth breathing quite a bit, and this causes a lot of distress because the child does not get adequate rest. Now for this, the medications as prescribed by the doctor in the proper course and duration need to be given, and the pain can be managed with the help of medication such as paracetamol, which will again be prescribed by the concerned specialist. So along with this, gargling with warm salt water also can give a lot of relief, and taking care of the other factors where exposure to allergens or other bacteria and viruses can be avoided. So if the child is sick, it is essential that the child be kept home rather than forcefully sent to school, such that the infection does not spread to other children as well.
Doctor, are there any potential complications associated with untreated adenoid infections?
Now, if these adenoids and tonsils are untreated, then what happens is the infection continues for a much longer period of time. Now, as the child grows, these adenoids usually should regress in size, but then they have already done a lot of damage in the process and then reduce in size. So, because of this, the child tends to develop a long face, which is in medical terms called as adenoid face.
Doctor, so assuming surgery is done, will it solve all problems?
If we assume that medical treatment is not working and surgery has been advised by an ENT specialist, then doing surgery alone only removes the blockage of the soft tissue of adenoids and or tonsils, whichever one may be affected. But then the path of airflow as such still remains narrow. So surgery is only 1/3 of what is the required treatment, along with medical management, and surprisingly a lot of dental treatment also that is required to take care of the facial structure if it is narrow in the first place. So what we suggest is post surgery, every child needs to have a dental evaluation definitely, so that we are able to assess whether the jaw and the nasal structures are narrow or not, and whether they require further treatment in the form of dental correction or any exercises.
Doctor, what role do dentists play for such cases?
So now when some cases are treated only with surgery, they come back with complaints a few months later saying that all the problems like mouth breathing and noisy breathing and snoring, etc., may not be solved over the long run. So in such cases, what a dentist needs to do is identify whether the child has a very small oral cavity and a small upper jaw, which is more of a tent shape. That means it is called as a high arched palate. So once this is identified, we can help to put in a device that is called as an expander. Now this expander helps in increasing the size of the jaw. Now we all know that the nose and the mouth share one common bone, which is called as the palate. So by putting a device on the palate, we are expanding this palate and thereby increasing the base of the nose as well. So this gives more room for air to go inside and therefore gives it a smoother part to breathe.
Doctor, can breathing and functional exercises can help?
Yes, breathing and functional exercises definitely do help. Now, because of the wrong function that has been established over all these years, the nose fails to work as it should. So, the nose does not carry humidify air, instead, the mouth is doing the job for the nose. So, now what dental and functional treatment primarily involve is creating a better path inside the nasal airway for easier flow of air, increasing the size of the palate, and allowing it to settle in such a way that the teeth touch each other properly. Now this only corrects the structure, but what about the wrong function that has been learnt over all these years? For doing this functional change, what they need is a set of exercises called as myofunctional exercises, basically a form of yoga, breathing exercises and tongue exercises, which will help this function to correct gradually over a period of time, provided these exercises are done very sincerely and under supervision.
Doctor, how does expanding the jaw improve breathing?
So as I mentioned, the nose and the mouth share a common bone in between, which is the palate. So the roof of the mouth is the floor of the nose as well. So as dentists, what we do is put in an expander, which may be a fixed device on the teeth, it may be a fixed device on the bone, or it may be a removable device depending on the kind of structure that the child's face has. So these are expanded gradually, just less than a millimeter per day, which will slowly cause new bone to deposit and therefore increase the size of the base of the nose. So now this gives us a better path to have a smoother airflow and give the child a lot of comfort in terms of nasal breathing.
Doctor, how long is the treatment in children and is it painful?
Now the treatment as such with dental devices is not at all painful, In children less than 10 years of age, the upper jaw, as such, we know, consists of two bones. So, in less than 10 years, these bones are not fused. Therefore, any device that we use easily causes these bones to move apart. And in the period of time of 3 to 4 months, for which the clip needs to be retained in the mouth, new bone gets deposited. So, in younger children, it is definitely not painful. Now, above 13 years of age, sometimes it may be a tricky situation where a part of the bone may have fused and a part may be open. So, this needs to be diagnosed properly and then treated accordingly. It may require a minimal surgery in the process or require advanced techniques called as mini implant assisted rapid maxillary expansion. So, usually the treatment duration is about 3 to 6 months of expander treatment, and this continues into braces to align the teeth well such that the teeth sit into each other and provide a stable base.
Doctor, what would be your final recommendation for treatment of adenotonsillar infections?
So, a recommendation for parents of children who are suffering from adenotonsillar infections would be that do not continue with medication alone if surgery has been advised. It is always wiser to go in for treatment which would resolve the problem completely. But surgery alone does not solve the issue entirely. So, post surgery, a dental examination is a must. The dentist needs to be trained in orthodontics, which will ensure that they are able to take a good decision with assessing the risk of how the palate and the craniofacial skeleton is, so that they can help you with further treatment in terms of deciding if the jaw can be expanded, if braces are necessary, and if the lower jaw needs to be got forward such that the child is able to breathe easily. So, in most children having ear, nose, and throat infections, a dental evaluation is a must and needs to be followed with myofunctional exercises and braces as the child grows beyond 12 years of age to achieve a complete correction.
We have covered most of the topics related to adenoids. If you have still doubts, kindly mention in the comment box.